has introduced C-VASC, a first of its kind multidisciplinary rehabilitation program that brings together specialists in oncology, speech and
You ready, sir? Sir.
From the media. I would also like to welcome Dr. Hari Chaturvedi, Group CEO for Apollo Hospitals for Oncology. A warm welcome to Dr. Sapna Nangia, Dr. Naveen Hedne, Dr. Sandeep Dura, and Dr. Arkan, and all my fellow colleagues. It's an important day today because we are launching this comprehensive clinic, and as it was pointed out, it is important. We have seen survivors in head and neck cancers post their treatment. They have to face a lot. And what we have found out, they have a lot of difficulty in breathing, sometimes in talking. Speech also takes a problem. And that's why we at Apollo Proton Cancer Center thought we should come up with this initiative. For us, rehabilitation matters and recovery matters. For us at Apollo Proton, treatment ends, care begins. And that's the idea why we feel we should be going in for a clinic like this. C-VASC brings together specialists across oncology, ENT, speech and swallow therapy so that patient gets everything under one roof. By combining advanced diagnostics, innovative treatments, dedicated rehab support, we aim to help patients reclaim essential functions. Importantly, the clinic will also serve as specialized center for professional voice care, supporting singers, dubbing artists and broadcasters. This initiative is another step in Apollo Proton Cancer Center's journey of redefining cancer care. Thank you once again.
Today, I think as Karan pointed out, it's a very, very important day for us. And we actually are committed to making sure that the patients who come to us for treatment not just go back there, but they go back thriving. So they go back and do whatever they wanted to do, and that is our commitment. So today I was not expected to be here, but I just lined up, so I thought that I must take this occasion moment to thank you all. That because whatever we do, unless it goes out in the public, it's communicated well, and the people believe in that, the real uptake doesn't happen. So I think you play a very important role in taking this message that cancer today has come a long way. By on one side the numbers are growing, but on the other side the treatments are growing better. And we have more and more varieties of treatment, and therefore the questions of better quality of life are more alive than ever before. And that is why that is at the center of all that we do. And it's a combination of teamwork, as pointed out repeatedly, that today healthcare is a team sport and oncology is the apex of that. It's the ultimate pyramid. There's nothing as more complex which requires so many people to come together and deliver to one patient at each touch point. So that is what we are committed to. And once again, thank you Karan and thank you team for being here. Thank you.
Nice to see all of you here. You'll have to excuse me. நான் தமிழ் கத்துக்கிறேன் ஆனால் fluency இல்லை. So இன்னைக்கு English பேசுவேன். So let me just explain that head and neck cancers are the most common cancer amongst Indian males. They require our complete attention and focus to improve the results and improve the quality of life of patients. So not only do we want our patients to survive longer, we want them to survive longer cancer-free, and we want them to live their life they all have a role, right? They have a role in life. That role could be of a parent, of a spouse, of somebody who is a breadwinner, somebody who is a student. So we want them to go back to their role in life. And when we want them to go back to their role in life, then all the functions, whether it is presenting themselves to society, talking, eating in public, eating with their family, each of these things is very, very important. Very often, when patients are treated for head and neck cancers, we ask them, are you able to eat at a wedding? because that is critical. In India, wedding means slightly spicy food. It means maybe something which may also be crisp or slightly pointy. So are you able to swallow that? Have you recovered your swallowing functions? These are all the finer details that ensure that a patient has made full recovery after treatment. So as you know, Apollo Proton Cancer Center is the first proton therapy center, not just of the country, but also of South Asia, Southeast Asia and Middle East. It has been our privilege and responsibility to bring this technology into the country and to improve the quality of life of the patients, to improve the outcomes. That is what we have seen, and that is some result we are presenting in Astro a little bit later. In September in Boston, we are presenting the results of our experiments at the Apollo Proton Cancer Center of improved quality of life, better quality of life and better outcomes.
The Comprehensive Voice Clinic, but before that, I would like to give you a brief on what does a voice box do. So basically, breathing, speaking and eating are basic functions in a human. So any of these qualities when affected, it impacts our quality of life. So in a head and neck cancer patient, about 80% of these patients have one of these functions or multiple of these functions affected at any point in their life. Voice, airway and swallowing, they all are interconnected because they are all having similar structures playing their roles are being divided into the same structures. Now in a voice box, what does it do? So it opens and it closes, as in this seen in the picture. It opens and it closes when we are speaking, we are eating and we are breathing. So the main function of the voice box is preserving the airway, because when we eat, when we swallow, there are possibilities of the food particles to enter into our airway, which we generally perceive as choking. And also the secondary function being sound production or the voice. Now what are the signs or symptoms, or how does a patient come and tell us that they have difficulties? So when a voice patient comes to us, they generally have complaints of hoarseness of voice, strained voice or weak projection in the voice, and breathiness or complete loss of voice. When an airway is having a trouble, they usually complain about shortness of breath, chronic coughing, wheezing, noisy breath or stridor, and recurring choking sensation. In case of a dysphagia or difficulty in swallowing, generally the complaints are pain while swallowing, food or liquid getting stuck, throat clearing frequently, coughing during meals, and nasal regurgitation. Now, what are the causes of all these problems? Majorly, the voice, airway and swallowing complaints can arise in head and neck cancers, neurogenic disorders or tumors, structural obstruction caused by benign growths, and inflammation or reflux. In a head and neck cancer, generally these problems can be impacted upon presentation when the tumor shows itself, or as part of a surgical procedure, or while undergoing the treatment, or as part of post-treatment. So in the pictures you can see some of the tumors. These tumors can impact the closure of the voice box, impacting the voice or breathing and swallowing as such. Commonly in head and neck cancer, the tumor location is very important when we are deciding on how to intervene or how to manage the problems. So tumor location, generally when it comes to a voice box tumor or somewhere in the throat, majorly impacts the swallowing function and also airway. The problems with tongue, when the tumors are around the tongue or the back of the tongue or anywhere in the oral cavity, they have a bigger problem when it comes to the speech. Now the surgery actually impairs or changes the structure of the oral cavity or the throat. So that can also have an impact in the swallowing function. The radiation and chemotherapy, as ma'am mentioned, we are having advanced radiation and chemoradiation. So most of the patients have some amount of edema or swelling that can impact from the treatment, which can cause some amount of airway problems or swallowing dysfunction.
So I would be happy to announce the launch of C-VASC Clinic. That is a comprehensive voice, airway and swallowing clinic. We all know that human beings are special because of the ability to speak and communicate, whereas in the rest of the animal kingdom, most of the animal kingdom, the purpose of voice box is to only prevent food from going into the lungs and choking. But human beings, we have developed a special skill to speak, communicate, which makes our identity and currently where we stand. So not only face is the identity of a person, voice is also identity of a person. So when a patient, when somebody loses their voice, I don't like to say patient, when somebody loses their voice, they lose their identity. So it's very important to convey that when we treat somebody who is suffering with cancer or any problems with the mouth or the voice box, can be treated with minimal effect to the voice, which can help them to overcome and get back to their normal and get their identity back. So World Voice Day is celebrated on April 16th of every year. So this year the focus is caring for our voices. So it emphasizes on daily usage of voice, which is very important for everything we need to speak. Second is professional voice users, how to look after special professional voice users, their voice, and also to develop research and propagate voice health or vocal health. This World Voice Day celebrated every 16th of April. Next is airway. Airway or breathing is means the most important thing in life. Without breathing, we don't exist. Third is swallowing. Swallowing is not just an act like some animals like snakes swallow the food, but for human beings, swallowing is not just an act. The thought of swallowing results in secretion of saliva. There are a lot of nerves involved in swallowing, a lot of muscles, up to 50 muscles are involved in swallowing. It's a coordinated effort. So whenever there is a tumor or a cancer in these areas, there will be some effect on all the three aspects, that is voice, airway and swallowing. So that is why the concept of this C-VASC came up. So when we treat as a surgeon on any of these cancers, we always whenever there is a need or requirement of surgery, we remove the part of the tumor along with some normal tissue, which may affect the ability of a person to speak, eat in public and communicate well. So how do we minimize this? With something like minimally invasive surgery, we try to reduce the effect of this treatment so that patient can get back to their normal eating, at least whatever, not everything, but to a satisfactory level. Speak, publicly speaking, because a lot of these patients are in the prime of their age where they're still working. So any effect on their voice, swallowing can give them social, psychological and economical distress. So we need to, whenever we see these patients, we need to make sure that we give them least morbidity. So we incorporate robotic surgery, we incorporate reconstructive surgery, where if we remove a part of the tongue, we replace that part of the tongue with some tissue. Tongue is one of the most difficult organ God has created. We cannot recreate a tongue, but we can take some tissue and give that volume or can replace that so that patients can speak and eat as good as others.